And we're back. So, what's going to happen with all this healthcare stuff? I mean, if McCain wins, he'd probably try to push some of his ideas through, but he may have a hard time given that Democrats will still likely run Capitol Hill. If Obama wins, he's likely going to make some strides towards universal healthcare. So I think what we have to ask ourselves is how good are these plans if only parts of them are actually implemented? That's really the way to evaluate any program. Seriously, think about this analogy. I like this one, okay? It's kind of hard though. If you're living in Chicago, would you rather take a trip to New York or LA? You can evaluate that decision. You can make that call. But what if you only make it halfway? Now, do you want a vacation in Wyoming or Pittsburgh? You probably don't want either one. That's a harder call, but that's really honestly what it is. And being an ideologue isn't helpful. An ideologue is someone who thinks things should just be a certain way philosophically. I'm for less government, and that's that. Well, you know what? That's not helpful, okay? We need practical solutions. After all, conservatives are against corporate welfare, but it's okay to bail out Freddie Mac and Fannie Mae to the tune of hundreds of billions of dollars just when they need it. What does that phrase "to the tune of" mean anyway? What does that tune sound like? I guess it's whatever millions of people being screwed at once sounds like. So maybe it's an orgy. I don't know. Anyway, to some extent, though, you do have to start with what you truly believe is fair. Because both plans have their merits, there's really nothing wrong with the personal responsibility of the Republican plan, and there's certainly nothing wrong with the empathy of the Democratic plan. So how do you evaluate it? Well, do you believe that healthcare is a privilege or a right? It's a fair argument. To me, I'd have to say it's a privilege. We shouldn't let people die in the streets any more than we let them starve to death. But we don't. Doctors take an oath to treat the patient in front of them. And it's illegal for a hospital to turn someone away, even if he doesn't have insurance. The hospital has to treat him. And just like starvation, no one starves to death in this country. There's soup kitchens and there's shelters. There is a safety net. And besides, if you're rich, you get better everything. That's just the way it works. You get better air, better food, water, shelter, clothing. Why wouldn't you get better health care if that's just the way it works? And why should I, as a healthy person, pay for an unhealthy person's lifestyle? Granted, most of why I'm in shape has a lot to do with genes and luck, but I do eat right and I do take care of myself, so why should I chip in for some morbidly obese wastoid? It's an underutilized word, wastoid. Perhaps that's what we should do. We should do it by weight. Come in and get weighed every year, and your premium varies as a function of that. Not sure what we do about diseases that make you gain a lot of weight or the invasion of privacy thing, but honestly, I'm all for it. I think that's a good plan. It's a Satyal plan. Not sure how they'd work in India, though, because everyone there is skinny anyway. I mean, they'd run all their stuff at the local and state level, though, and who can really measure anything over there with the population and all? But maybe that's the solution here, too. Fewer people. See, we're the only developed nation without universal health care. That reflects the conservative values of this country, which has really never made any sense to me at all, because this was founded to be like land of the free, home of the brave. It's supposed to be progressive. But anyway, we're also the only developed nation that's so pro-gun, the only one considering a ban on abortion, the only one that starts so many wars, and the one with the death penalty. Think about that. Conservatives need to move on the abortion one, though, okay? They say less government interference, but it's okay to tell us what to do with our bodies, like the most personal, private decision you can possibly make. Anyway, see, the other ones make more sense. More guns, more wars, more deaths. That's one way to lower costs. Just get rid of all the people. That's it for us at the AC States of America. I've been your host, Rajiv, and I still am.